Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honourable Andrew Furey, Premier of Newfoundland and Labrador, the Honourable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon, everyone. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, February 17th, 2021. This is now day 5 of our heightened alert status, and our lockdown measures have been in place throughout the province since Friday evening. I will turn things now over to Dr. Fitzgerald for an update.
Thank you, Premier. Good afternoon, everyone. I appreciate your patience. Everyone was waiting on me, just for the record.
It's okay. We'll wait for you every time.
Since the media advisory yesterday, we have 44 new confirmed cases of COVID-19 in our province, which are all under investigation at this time. There are 42 in Eastern Health, 14 are under 20 years of age, 8 are between 20 and 39, 9 are between 40 and 49, 5 are between 50 and 59, 4 are between 60 and 69, and 2 are over 70. 2 of the cases are in Central Health, and both are between 60 and 69 years of age. There are 21 new presumptive positive cases in the Eastern Health region. A presumptive positive case means the individual tested positive using an antigen test, also known as a rapid test. It is not a confirmed case until the provincial laboratory performs the PCR test, which is considered the gold standard in testing for COVID, and confirms the rapid test result. It may take several days for confirmatory testing to be completed. Once presumptive positive cases are confirmed positive, they are reported in public updates as new confirmed cases. For example, 10 of today's 44 new confirmed cases are previous presumptive positive cases. That being said, presumptive cases are treated the same way as confirmed positive cases. As soon as we have a presumptive positive, these individuals are contacted by public health and advised to self-isolate. Anyone considered a close contact is advised to quarantine, and contact tracing by public health begins. The total number of cases in our province is now 755. There have been 3 new recoveries, 2 new in Eastern Health and 1 in Western Health, leaving 338 active cases in the province. 1 person is in hospital with COVID-19. 2,573 people have been tested since yesterday, for a total of 97,517 tested to date. If you have been tested, it may take 72 hours or more for your test results to be available. If you have an MCP card, please continue to check our website for your results. This will be the fastest way to access it. If you have had a rapid test done, you will be notified by phone if it is positive. If it is negative, it will go to the public health lab for confirmation, and negative results will not be posted on our website until a laboratory confirms it. This fluctuation in case counts is expected as we continue to see thousands of people coming forward for testing as a result of contact tracing, exposure notification, and or the development of symptoms. Because this virus is more transmissible, it can spread from person to person, even through brief, close contact, less than 15 minutes. This means we will find more close contacts for each positive case. Remember that these new cases are the result of interactions as long as 2 weeks ago. This means our behavior now will determine how well we fare in the weeks to come. Strict adherence to public health measures and restrictions is essential. There should only be 3 reasons to enter an indoor public space at this time. If you have to purchase essentials such as food and medication, and only 1 person per household should enter a store unless they require an escort or there are no other adults in the home to care for children. If you are required to be physically present at work, or if you require emergent or urgent medical care. Proper public health measures are critical. Make sure there is at least 6 feet distance between yourself and others who are not in your bubble, even if you are outdoors. Wear a non-medical mask. 3 layers is best. Make sure there are no gaps for droplets to enter or escape. It must completely cover your nose and chin. Wash your hands or use hand sanitizer after touching any common surfaces and when entering and leaving a public space. Avoid touching your face. Stay home as much as possible. Keep your contacts only to those in your household, or if you are living alone, the household you have joined bubbles with. If you have been advised to self-isolate for any reason, either through an advisory, by public health, or because you or someone in your household has symptoms, please adhere to the requirements. Do not leave your property. Although it should be clear to everyone by now, I do feel the need to repeat that informal social gatherings should not take place, either outdoors or indoors. We know that even small and short social interactions can result in virus spreading quickly to families and workplaces. It is these informal gatherings that we worry about the most, because we know that public health measures such as masking and distancing are often not in place, leaving everyone exposed. Every action by every person counts. Remember, these restrictions are not forever. The faster we can contain this outbreak, the faster we can ease restrictions. And I saw something on social media the other day which made me stop to think, so I'm going to share it now. And it said, we need to stay apart now so that when we come back together, no one is missing. As a recap, for those who may have just joined us, we have 44 new confirmed cases since yesterday's media advisory, and the total number of cases in the province is 755. This is Random Act of Kindness Week, and it could not have come at a better time. Acts of kindness are needed more than ever, and there are so many ways to help one another. If you are heading to a grocery store, ask your neighbor if they need anything. Drop a meal or baked goods at someone's doorstep. Clear a driveway, sidewalk, or a path for someone who may find it difficult. Reach out by phone to people who may be isolated or struggling. These kind and simple gestures go a long way in raising spirits and reducing isolation. Regardless of our physical distance, we are all in this together. So hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. There are a couple of important things I want you to take away from today's numbers. First of all, don't be too disheartened when you see numbers go up like this. It means that the testing is working. We are finding and identifying the virus, we are isolating it and furthering the process of containment, which is critical. Second, as has been said before, the virus moves with people movement. So that's why a lockdown right now, especially given what we are dealing with in terms of the UK variant, is essential, critical for containment. Though it is early yet, we have to trust it will work again as it did last time. And we all must dig deep and abide by it. Dr. Fitzgerald and her team can only do so much, and they've done a lot. It's up to us now, all of us, to listen and follow their instructions. That is the very best way to get us back out of this heightened alert status. Yes, things have changed, but we can't allow COVID complacency and fatigue to set in. We must stay vigilant and keep our spirits up. Together, Newfoundland and Labrador, we will get through this. And to echo Dr. Fitzgerald, let's just let kindness be the only thing that truly spreads. With that, I'll turn it over to Minister Haggie.
Thank you very much, Premier. Day 346 since the pandemic was first arrived here, and we're now at day 5 of Alert Level 5 for the second time. I'd like to start by thanking Eastern Health and their public health and staff in general, who've done an absolutely amazing job of beating down a backlog for testing that was several thousand to actually none today. They can only be congratulated for achieving that. I'd also like to mention a couple of groups who've been actively involved in the testing sites who may not have achieved the acknowledgement that they deserve, and that's the Canadian Red Cross and the St. John's Ambulance, who have both been active in flow control and traffic control at the super site in metro area. Again, cases continue to be found, and that's good. A case identified is a case contained. As a result of this, and the fact that we are seeing sporadic cases across the province, pop-up clinics are appearing across the province, and their location is determined by public health recommendations based on geography and cases. So stay at home unless you need to go out for essentials. The virus only moves when you do, and if you move, you must mask and stay 6 feet apart if at all possible. We should concentrate on spreading kindness not COVID, and we each have our part to play. And I think with that, Premier, I'd hand it back to you for the rest of the event.
Well, thank you, Minister Haggie. I'll now turn to media for questions.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Jackson with The Telegram. Please go ahead.
Hello.
Hi, Peter.
About a week or so ago, the public health staff at Mount Pearl Senior High stopped using rapid tests. And I understand that they just started using them again recently. Can you explain how and why these tests are being used? Like, what are the rationale for using them?
Sure. So we're using the rapid test to try to find cases as quickly as we can. They do allow us to identify positive cases, within a half an hour or so. And we have certainly in our experience through using them at the Mount Pearl site, we found that, we had a great, we didn't have a high false positive, I guess I'll put it that way. So all of the positives that we identified through the rapid testing went on to be confirmed as positive in the PCR testing. So through that, we decided we need to use it in some other settings. With everything that was happening initially in the Mount Pearl site, there were just some logistical considerations that had to happen there. And so we then have moved some of that testing to other sites just to make it easier, and now we're using them again. So it has been going well. We are finding those positive cases very quickly. The downside with the rapid testing, of course, is that it does have a higher false negative rate. So that's why everybody who has a test has to continue to isolate until they get their test result back and that it's confirmed a negative by PCR. We have had some of the people who, we have had some of the tests, I should say, that were negative on the rapid antigen testing that then went on to be positive later with testing. So that's why it's so important that people stay isolated until they get a negative test result back. But right now, that's how we're using them here in St. John's. We've also used them, when we want to test rapid in other areas where we may want to test a lot of people very quickly, and so we're using them in Central as well. And that has been, or we will be, I should say. So we hope that will give us a snapshot in time of what's happening in different areas of the province.
And I think it's safe to say, just to be clear, because I've heard some concerns about this as well, it's a screen followed by a confirmatory test. So there's no one just getting the rapid test. They're getting 2 tests to ensure that that false negative, there's no slippage through there, if you will.
Yes, that's how we're using it here in St. John's right now.
Yeah, which means you have to get a swab, 2 swabs.
2 swabs.
That's right.
Yep.
That's right. Yep.
It's not fun.
And the minister, I guess this is for you. You mentioned that the staff have beaten down a backlog, I guess, of test results. We've heard of people waiting for 4 days on occasion to get results. Does that mean that things should be moving more slowly now?
Yes, certainly. Thank you. As of last night, early this morning, the number of people waiting for a test across all of Metro was 182. In terms of times, the time to get your test result now should be less than 72 hours. It may be longer for confirmation of a presumptive negative test because some of these we're using surge capacity from the federal laboratory in Atlantic Canada rather than doing them in-house. But given the fact our numbers now of testing are nowhere significantly different from the capacity of the lab, that turnaround time should fall further.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. Old genome sequencing is expected to be up and running later this week. And I'm curious, what does that mean for the testing process? Will people need to have their samples tested 3 times? First, the rapid antigen test, then our usual COVID test, and then will they be tested for the variant?
With regard to whole genome sequencing, there are some requirements that have to be there before that can be done. And right now, so it will only be done on those tests that have the the PCR test done, our usual COVID test. And then there's a parameter that they look at called the cycle time, and the higher the cycle time, the weaker the result, the positive result. And so the cycle time has to be below a certain threshold before they can actually do that whole genome sequencing. So that's one consideration. And then the other thing will be, do we need to have that information? So, if we have a case that pops up somewhere else that doesn't seem to have a source, obviously that's going to be a case that we would urgently want to have whole genome sequencing done on. So it allows us, it still takes a bit of time, just the process itself takes time. It's not that there's a backlog or anything like that, but it's a couple of day process to actually get that whole genome sequencing. Unfortunately, finding out about this genetic testing is not as quick as what people think it would be based on what they see on TV and things like that. So it does take a couple of days to actually get the test results back, even if it's done here in our lab.
Right on. And I think on Monday I asked about this, but you mentioned that a specialist is here in the province right now. They are currently setting up the equipment, and so I'm curious, it sounds like this has to be done by someone with this specialized training. So I'm wondering, will the whole genome sequencing lab still have any kind of capability as what we have through the public lab?
Yes, so the person that's here is here in Eastern Health and employed by Eastern Health, and will be working to do that here. So they are staying here. They will be able to do that.
And
No, sorry, I meant like the public lab. You have a lot of employees who are currently running it, but if there's only one person overseeing the whole genome sequencing, it sounds like it won't be able to run at the same capacity.
So it depends. We may not need quite the same capacity. I doubt we'll be doing 2,500 whole genome sequences a day. We'll be taking a selected group that will be running through. We assume now that any case that we have that's popping up in the metro area for sure, and at this point is the variant. We don't need to test every case to know if it's the variant. If we saw cases popping up elsewhere in the province, we would certainly want to test those. We may want to test others of our travel-related cases just to make sure that we're not seeing more of the variant. And we may want to do a cross-section of cases of our positive cases that we would want to do testing on. So I don't know, sorry, I said 2,500, but it would only be our positive cases anyway. But I don't know that we'll be doing testing on all of our positive cases. There may be a selection. We just have to make sure, once again, that we're using that testing in the most effective way to give us the information that we need.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, I've talked to people who don't have a car who need to get a COVID test. They were told by public health that they should take a cab. If they're supposed to be isolating, why is it considered safe for them to get into a car with a cab driver for what we've seen could be an extended period of time with some of the waiting in lineups to get tested?
So I can't speak to that specifically, but I do know that those conversations are happening to address that particular group of people, and so we hope to have a solution for that sometime soon.
And so why isn't there a solution in place, and maybe the minister might be best to weigh in on this as well, considering, why was the assumption made that everyone would need to have access to a vehicle in order to get tested?
That wasn't the assumption, Peter. If you remember right back at the beginning, we did make arrangements through public health to Initially, it was for people who had mobility challenges in terms of disabilities and those kind of things, for public health to actually visit them in their homes. This has been extended, and there were discussions as recently as yesterday about how to do that for people who had challenges with mobility. We don't want anyone to have a barrier to a test. I think the challenge over the last 3 or 4 days has simply been one of capacity within Eastern Health to be everywhere, doing everything, given the backlog. Now that problem is resolved, and the wait times should be minimal at any of these super centres for sure, and they are appointment done. The challenge has been people, unfortunately, with their appointments slipping or arriving inappropriately or even drop-ins. So I think we should have a practical working arrangement very shortly. In principle, it existed all along.
Thanks.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. Dare I go into some math here, but on the presumptive cases, so 44 today, did you say 10 of those were previously presumptive cases?
Yes, that's right.
And they've now been confirmed positive?
Right.
So how many are outstanding presumptive at the moment?
So the outstanding presumptives, we have 57 that we're waiting to hear back from.
And, going to that, there's some questions about the negative, whether or not they come back negative. But what does that say about the accuracy of them then? If we have those negatives and then they're assumed presumptive positive until they are proven otherwise, are you still okay with the accuracy of those?
So the test that we're using, which is called the PanBio test, it's so any test, we don't talk so much about the accuracy as we talk about the sensitivity and specificity of the test. So we know that the specificity of this test is quite good. So that means if we pick up a positive with the test, it's likely to be a positive, and so that's a good thing. Those are the people we want to find. The sensitivity, which is if you get a negative, is it a negative? That's not quite as good. So there is a higher false negative rate with it. We do recognize that we will not be catching every positive with these tests, but we are catching probably 2/3 of them. So, that's good. We're catching them quickly. We're having people still to isolate until they get a negative result back from a PCR test, which is done at a lab. But those that are positive, we are able to start contact tracing on very quickly and try to get that, try to break those chains of transmission as quickly as we can. Otherwise, all of them would be going to the lab with a slightly longer turnaround time, and it would be taking longer to do that contact tracing. So, this is the balance that we have to achieve. So we know that we're not catching every positive with these tests, but we are catching about 2/3 of them, and that's certainly putting us in a better position. And we're not increasing the risk because those people are still in isolation, and we will get those negative rapid tests. Then they will get another PCR test to confirm that they're negative. And if they're not and they come back positive, then obviously we treat them as positive. So.
Thank you for that. And the Premier of Prince Edward
that was
Island.
Your two questions,
I'm
Brian,
sorry,
actually.
I thought that was all together. Thank you.
No problem. Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Minister, you noted surge capacity, and that's why we're sending some of the testing to the Atlantic lab to be confirmed there. Can you explain to people why this may be adding to the results of them having to wait longer? Hearing some people saying they're still 96 hours and haven't heard about the results of their test.
Yes, my understanding is that the presumed negative from the PanBio are the ones that are going out to labs outside. Our concern is identifying positive cases, as Dr. Fitzgerald has very eloquently explained to the previous answer. My concern equally is those people who may assume they're negative if they have a PanBio result, who will then feel that they can move around more freely, when in actual fact we need to make sure it isn't a false negative. the challenge around the turnaround time is that we have transportation times in there as well. I think those times will drop because some of them represent the surge through the weekend, and I've alluded to the numbers that were managed by Eastern Health. And I think now with no backlog and 2,500 people being tested a day, that's well within the capacity of our local lab to deal with. So that will deal with some of the transportation issues. But again, people are notified immediately as soon as any positive comes, be it presumptive or confirmed, but they are not notified of a negative until we know it's truly negative and confirmed negative, hence the longer delay for negative individuals.
Thank you. As well, when it comes to the testing, we know for urgent and emergent procedures that require surgery, some of those are still taking quite a while for turnaround time on testing. Are we looking to prioritize those so that we can have those procedures done?
I'll take a stab at that. The short answer is yes. Again, it was a question of, firstly, on Monday and Tuesday, of clinicians actually going through their operating schedules or procedural schedules to determine which procedures or diagnostic tests had to go ahead. So there was a little bit of a delay there in organizing those because obviously there's no merit to testing someone if they're ultimately not going to have their procedure. The short answer again is now the bulge, the surge has gone through and we're in a steady state. Those tests for what clinicians determine as urgent or semi-urgent procedures will go ahead in with the rest.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Yes, thank you very much. I can imagine right now that there are a whole lot of people sitting home who are positive, who are concerned and worried about their recovery. And there are those who, of us, because I'm one of them, who are sitting home, who are waiting on a test result, and that can be hard and stressful and make us anxious. And now, even after today, perhaps some people are concerned about testing accuracy, which I don't think is actually an issue, but sometimes people's mental health can spin that. I'm wondering if you could give us all an idea of what the recovery process looks like and how one would know for sure that one is 100% recovered and can go into that recovered category on the government website such that it will help us ease all of our anxiety around it.
So at the moment, we do consider people recovered in the same way that we have before, which is your symptoms have resolved and you're not using anything to like acetaminophen or ibuprofen to bring your fever down or something like that. So you have to have recovery of your symptoms without the use of any fever-reducing medications. And then it has to be at least 10 days since the onset of your symptoms. So if it has been 10 days since the onset of your symptoms and you still have symptoms, you won't be counted as recovered. But if you're 10 days and your symptoms have completely resolved, then you will be counted as recovered. Very mild illness and won't feel like they had much wrong, and they get better very quickly. We know that some people have more severe illnesses, and while it may not make them sick enough to have to be in hospital, it certainly makes them feel very unwell, and they may feel that way for a week to two. And then we have certainly some people who have ongoing issues. With regard to people who are older, we know that's our biggest risk factor for severe disease is increased age. So we certainly, and just myself personally, having worked in long-term care for many, many years, will say that there are sometimes people just don't ever kind of get back to their level of functioning that they were at before they got really sick. So that's why it's so important for us to protect that vulnerable group of seniors who are in long-term care facilities and personal care homes. So, it's a variable, recovery is variable depending on the person really, and but from a strict definition of recovery, it's 10 days post-onset, so after the onset of your symptoms, provided your symptoms are resolved.
Jason, just let me take a stab at the anxiety around the testing again, so because I think it's going to come up over and over again. The rapid test is a screen, and if that is positive, then it allows the contact tracers and the people of public health to immediately, within an hour, start to contain all the contacts of that person. If it's negative, if it's positive, it still goes off for confirmation with the second swab for the PCR test. But in the meantime, while that delay is happening, it allows contact tracing to do its thing. With respect to a negative screen, we still want you to isolate, we still want you to look for symptoms, but then we're waiting for confirmation that it is truly a negative by the PCR or the gold standard. So I know there's be anxieties and waiting for results, but just be patient and follow the rules, and we will allow public health to do their thing.
Wonderful. Thank you very much for breaking down that and also the recovery process in a way that a lot of different people in a lot of different segments of our communities can understand it. Just to confirm one thing about the recovery, are we leaving it up to sort of an honor system for somebody to say to themselves, I have recovered based on that information, or do people go get tested again?
So public health basically determines if a person is recovered and released from public health restrictions and guidance. We are currently discussing, and that's a discussion that's happening everywhere, not just here, as to whether or not people need to have a test post recovery before they are able to be considered recovered. The difficulty we've had with that previously is that people can have dead virus particles in their system, in their nose and other areas for quite a long period of time. So it hasn't proven to be very fruitful. So generally speaking, we go on symptoms.
Okay, wonderful. Thank you very much.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I'm still getting a lot of questions about vaccine priorities, and I hate to bring it up, but as long as I'm getting them, I feel I should pass them on. Is there any decision given in principle, at least, to who might fall in priority after phase 1 vaccination?
Well, certainly on our, we do have some priorities that we have on our website with regard to advanced age. In our phase 1, we wanted to look at people who are over the age of 85, and we looked at congregate living facilities, residents there, as well as staff, and then our frontline healthcare workers, as well as people living in our Indigenous and remote and isolated communities. So that's our first group. So we're moving, once we get past that, we'll obviously be moving down the age groups. So we'll be trying to vaccinate people who are older, as well as we've indicated on the website, our other congregate living facilities. And then there are other groups as well. The final decisions have not been made at this point, I don't think anywhere, but and certainly the delay in vaccine supply has unfortunately delayed our ability to be able to make those decisions, because when you're not 100% sure how much you're going to get, it's hard to prioritize. We are working on those decisions right now. But we will have to ask people's patience, because we have been caught up with this other thing, so we'll have to but we will be coming forward with that very soon.
Okay, thank you. I have a situation of a rotational worker that found themselves kind of going in circles with the local healthcare system. As you're aware, in a lot of settings, whether it's a seniors home or a hospital, whatever, rotational workers are kind of singled out on questionnaires. This person couldn't get to see someone in emergency. They couldn't get an X-ray. They had serious chest issues, and even though they had a test, it just didn't seem to pan out. Is there a kind of a institutional bias now against rotational workers in terms of healthcare?
There certainly shouldn't be. Rotational workers are an incredibly important part of Newfoundland and Labrador, and we need to make sure that saddens me to hear that someone would be biased to the point, or some, I don't know the specific details, Peter, obviously, but it saddens me to think that someone would not be able to get health care that they need because they were deemed a rotational worker. That's certainly not something that any of us on this panel would ever support. With respect to rotational workers and anyone who's listening, please, be kind and ensure you're following the rules, but the rules will protect all of us, including the very important rotational workers.
Okay, thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, you mentioned a few moments ago that Eastern Health hired the specialist to run the whole genome sequencing lab, and I'm wondering a bit more clarification on this person's role. Were they already in the province, already working for Eastern Health, or did they have to be brought into this province, hired to do this work, and brought here?
My understanding is that they were already here.
If I could offer an answer here, we have had a personalized medicine program within a combination of Memorial and Eastern Health, looking at genome sequencing for some time. Indeed, I can remember attending an event with folk from Eastern Health and MON where equipment was provided for this purpose as part of what's called the TPMI initiative. We have genome sequences there, and I think this was simply a repurposing of that equipment and staff to match the needs of Dr. Fitzgerald's shop and public health once whole genome sequencing became an issue for identifying variants. So that capacity was there to some extent. I think the reason that the person was here predates COVID.
Perfect, thank you. And Minister, has there been any updates on the number of healthcare workers impacted by the virus? We've heard previously, some 500 were self-isolating, but I'm wondering, what is that current number, and have any tested positive?
We're aware of about, I think, 530 currently isolating across the province. That number does fluctuate. I don't actually have a detailed breakdown today, but certainly I can provide that for you. In terms of positivity, there have been healthcare workers who have tested positive, but under those circumstances, each one has specifically had recommendations from Occupational Health and Safety, and I'm not been advised that there are any impact to either service delivery or patient risk. But I can certainly get the numbers from today as a snapshot for staff self-isolating.
Perfect. Thank you so much.
Our next questions are from Peter Cowan with CBC. Please go ahead.
QP is called for N95 masks for all healthcare workers. I'm just wondering what the response is to their demand. Minister, probably best one.
The Minister is probably best for that one. I was not aware of that demand.
No, we actually, there was a meeting with unions and the Department of Health late yesterday, and I haven't actually been briefed on some of the contents of that, but certainly PPE has been a hot topic with them. Currently, as far as PPE inventory is concerned, we are not regarding that as an issue. We have a really good supply. I couldn't tell you exactly how much, but the last time I looked, it was well over 500,000 N95. And we have another big regular order that goes in quarterly that just happens to be going in at this time too. In terms of the specifics of what PPE is required under what circumstances, that very much is an infection prevention and control issue. They are guided by public health, infectious diseases, and also by national standards. So I'm not aware as yet that those have changed. Should they change, we will obviously match our approach and our policies to national standards. But I can certainly go back and see what the status of those discussions is between IPAC, Public Health, and the Public Health Agency of Canada.
And Dr. Fitzgerald, I have a question about the new cases that we're seeing over the last couple of days. Are these generally people who are already isolating because they were identified as a close contact, the sort of people you would expect might test positive? Or are many many of these people may have just shown up randomly for testing or been at some of those commercial locations?
Yeah, so I think certainly some of them are still contacts. I think the answer is yes to all three, actually, Peter, because we are seeing contacts. I think we certainly got through a big lot of the high school contacts that we started out with. But there are other contacts, and then of course other cases have popped up, so there are more contacts with them. So there'll always be contacts coming through that have to be tested. We are seeing people who are symptomatic without any obvious exposures. They are certainly presenting for testing as well. And we are seeing people still from some advisories. So I think that will continue. I mean, hopefully the advisory part will start to go down now as we've proceed longer into our public health restrictions. But certainly we'll always have contacts and a certain percentage of people who are symptomatic.
Thanks.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. The province of Prince Edward Island just recently identified its first case of the variant, and the Premier was quoted as saying that basically that point of entry testing allowed them to nip that in the bud. So again, it comes back to whether or not that's something you're considering in our province.
We don't know that point of entry testing would nip this in the bud. In that situation, it did, but it wouldn't necessarily. Some of these people are not testing positive until more than 7 days after exposure, right? So we have to remember that. There's a false negative rate with every test. But certainly, this variant is it's a game changer, as I've said before. So we have to, as we've said from the beginning, if evidence changes and science changes and the epidemiology changes, which it clearly has now at this point, then we have to evolve with that. And so those are all conversations that we're having at the moment.
The gold standard is still quarantine, right?
Oh, yes.
That's what we can't forget in that equation. Yeah.
Yes, testing, with these variants now, testing will not be replacing quarantine.
Very good. Thanks for that clarification. The Teachers Association made a compelling case this week, noting that, if we want schools to stay open and relieve the pressure on childcare and essential workers and parents trying to balance work and home and all the rest of it, they are making a case now to have teachers somewhere high on the priority list for the rollout in phase 2 of vaccines. Can you comment on that?
Yeah, I mean, our problem here is we would give everybody the vaccine if we had the vaccine to give. The problem is we don't. And so because of that, we do have to prioritize. Our first priority is trying to reduce, what we call morbidity and mortality. So those severe disease and deaths. And we know that the biggest risk factor for both of those is advanced age. And so that's why we focus on our advanced age populations, and that's where we have to start with. We also know that the risk of spread and outbreaks are greater in congregate living facilities, such as long-term care, personal care homes, other types of living facilities like that. That's why we focus on those areas. I totally understand where teachers are coming from. However, we have to do the best balance we can with the numbers of the amount of vaccine that we have. And so we'll be taking all of it into consideration, but they're not easy decisions to make.
Understood. Thank you.
Brian, if I could add one other nuance to that as well. Whilst we know that the vaccine is very good at protecting the individual who's vaccinated, we as yet have no knowledge, one way or another, of whether or not that individual will transmit COVID to non-vaccinated individuals. And remember that currently no vaccine is actually available for children officially. It's not recognized yet. So whilst I understand everyone's concerns, my office is certainly, I wouldn't say besieged, but certainly has a steady flow of individuals or groups who feel that for one reason or another their circumstances make them a priority. And I understand that. Our challenge is we can only give people what we get in terms of vaccine delivery, and that's a manufacturing issue.
Thank you, Dr. Haggie. Just for the record, we are equally besieged. Thanks.
And to further Dr. Fitzgerald's point, like if we had enough, we'd love to give vaccines to everyone, and that's the ultimate goal. So just bear with us as we triage and prioritize as we learn of more availability. Sorry to cut you off there, moderator.
That's okay. Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Central Health and Labrador Grenfell Health are asking those who have been to the St. John's metro region to be tested for COVID-19. Dr. Fitzgerald, do you think this is enough to potentially stop spread there, or what else should be done?
So testing is not enough to stop spread. Nope. Our public health measures, staying home, keeping your contacts low, all those things, that's what we have to do to stop the spread. Viruses don't spread if people don't move and don't congregate. So that's the most important thing. The testing that we're doing or that they're doing in Central and Lab Grenfell is basically just looking for cases. We're just trying to get a snapshot, as I said, of what's happening. It's just one day, but it gives us an idea if we're seeing anything out there, and especially for people who have symptoms, it'll give us an idea if we have any cases in those areas. So they're trying to target it as much as they can, I think, at this point, just, so people who may have had exposures out here in the metro area in the last couple of weeks. As well, I think Central might be focusing on to try to get a snapshot in the younger population, just where we did see such easy spread through that group here in the metro area. They just want to get an idea of what's happening in those populations out there. So they have asked for certain schools, I think, to come forward, people in certain schools to come forward for testing. That's not necessarily it's not at all because there are cases in those schools. It's just because they want to get a snapshot of a certain group of, diverse group of ages and that sort of thing to see what's happening out there.
Thank you. And this one's also for you, Dr. Fitzgerald. When it comes to unregulated childcare, currently they're being instructed to operate as if they were under alert level 2 rather than alert level 5. Why is that?
So I'm not sure what their exact instruction has been, but my understanding would be that they would be under alert level 5. So everybody's under alert level 5, but there are, and I am not familiar with all the rules and regulations around or what's involved in unregulated daycares. So, perhaps that question is better pointed at someone else. But we're under alert level 5. That's the public health advice.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hello, thank you. I know we just talked a whole bunch about it, but I'd like to talk about vaccination again for a moment, if we could. I think we all agree that our seniors and our frontline health care workers to stop spread and to, decrease the morbidity rate is a really, really good idea. And I know that we're waiting on product, and it's not a matter of not wanting to vaccinate people. But I'm wondering, for those people who aren't necessarily specifically categorized in future phases of the rollout plan, like immunocompromised or otherwise not in specific good health, maybe they have pulmonary function issues, how do you go about assessing the degree of danger based on health condition? And will there be a list of that? Do people apply to be added to the list? I realize this is a conversation for the future, but assuming we have our healthcare workers and our seniors looked after.
Yeah, so I don't think, I don't know that anyone has come down firmly on that as to how that would happen. It's part of the problem is that we just don't have a lot of information about this virus and how it affects every different chronic condition that's out there. What we do know is that the biggest risk factor is age, and that is why we're focusing so much on an age sort of stratified rollout for a lot of these first doses that we're getting. I think those conversations will come, but at the moment, I certainly wouldn't want to speak prematurely. So I think I'll have to leave it at that and say they will be coming. But
I understand. So it would be reasonable to assume that as soon as there is data that suggests somebody with asthma is safer than somebody with high blood pressure, then we'll be able to tell asthmatics to apply, so to speak?
So, I mean, it's going to depend on things, just because, you know, there may come a point where we have lots of vaccine and everybody can get it. We may not even have to consider, do you have a chronic condition? Just like with our flu, you know, our flu vaccine campaign, you come forward and you get the vaccine. I mean, that's the hope, that eventually we'll get to there. So it's difficult for me to say that definitively at this time.
I understand. Thank you so much.
I will now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram. Do you have a final question?
Just a quick one about children in foster care. I understand a lot of people are still confused as to what they can or cannot do. They're not getting a lot of guidance. They're worried about expanding their bubbles. What is the ongoing situation with that?
Children in foster care.
So, I mean, we've had conversations and given our public health advice as to what would have to happen, but, you know, what's actually happening, I guess I'll have to direct you to CSSD for that answer.
If it's not getting out there, Peter, then I will certainly take that back and ensure that it does get out to the public so that these people looking after this important group of individuals can have the guidance that they need safely.
Thank you.
Elizabeth with All Newfoundland and Labrador. Do you have a final question?
I'm good, thanks.
Thanks, Elizabeth. Peter Cowan with CBC. Do you have a final question?
I do. If we're having more swabs than we have lab capacity and we need to send them off, why aren't we using the private labs that are located in the province that do have extra capacity?
Well, we've...
that situation... Oh, sorry.
Sorry, no, we're availing of the support from the federal government, and this was one of the ways that they said that they could help, and we certainly will take that help. And oftentimes what we do with the private labs is we confirm any positive tests that with the public health lab as well, so that could potentially add another layer of testing. But also, as Minister said earlier, the backlog, we've, you know, within days, this plan, this strategy that has been put in place has helped diminish, not fully eliminate, but diminish the backlog that has been there before. So it seems to be working at this point, but we'll reevaluate should we need to. Minister, were you going to add something there? Or?
No, I was just essentially going to say the same thing. We act as a validator or as a confirmer for the private lab, so it would be a circular affair, and the feds have this long-standing arrangement for surge capacity. And quite frankly now, the demand for swabs currently is more than able to be met by our existing capacity. And there's one more machine in St. John's being commissioned as we speak, which will further increase our public health lab capacity for PCR.
Thanks.
Brian Callahan with VOCM. Do you have a final question?
Yes, thanks. The central cases, the two cases in central Newfoundland, are they of the variant? And the person in hospital, is that person in ICU?
So I have no information regarding the central cases with regard to variant or not. It's obviously we just diagnosed them today, so we wouldn't be able to know that at this time. I'm not going to speak to the condition of the person in hospital, given it's only one person, and for privacy reasons, I won't be speaking about their condition.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
I do. Dr. Fitzgerald, when it comes to those who are asymptomatic and have tested positive, how will we know when they're recovered? Because their symptoms, it wouldn't be an onset state for symptoms.
So, sorry, Kellyanne, are they symptomatic or asymptomatic?
Asymptomatic, sorry.
Asymptomatic, tested positive, Then if they don't have symptoms, then it's 10 days from the date of diagnosis that we would consider them recovered.
Thank you.
Jason Piercy with Rogers Communications. Do you have a final question?
Yes, please. You mentioned earlier, Dr. Fitzgerald, that a positive test from our rapid testing can come through in as short as a half an hour. And those results are released as quickly as we can. So to get an entire province of people to take a collective sigh of relief, is it somewhat fair to say that for the average person, the longer you wait for your result, the more likely you're okay?
No. As I said, there is still a false negative rate. So there is still that chance that somebody who tested negative on the rapid test would have a positive result. About a third of our cases will be that, or a third of the results. So, we need to, I think people need to just think, you need to be patient. I know it's upsetting to have to wait for the results, but we're trying to do it as quickly as we can, and hopefully as time goes on, that turnaround time will come down. But I wouldn't want to sort of make that generalization for people. I'm really sorry, but I don't think that would be fair to do that.
No, that's okay. Just looking to get everybody to lower their blood pressure before we have another problem.
Thank you, everyone. Premier, do you have any final comments for today?
Sure. Thank you, everyone, for joining. I just want to reiterate what we were saying earlier. Don't be too alarmed by fluctuating numbers. That will happen over the next few days to next week. And the most important thing to do is to continue to follow the public health guidelines. And remember, we are in alert level 5, so don't move unless you have to move. And I also want to take this opportunity really to thank the educators and the teachers out there right now, the administrators, anyone who's been involved in pivoting to online schooling. It definitely warmed my heart. I was leaving the house today to eavesdrop a little bit on the classroom that was happening within my own kitchen. So I know it hasn't been easy, and I know there's still hiccups in the process, but to hear my own son learning and speaking French and was heartwarming and made me realize how far we've come and how much we've learned since the outbreak this time last year. So stay safe, everybody, and let kindness be the only thing that spreads. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease